Hello, my name is Nidhi. I'm a physiotherapist. Let me tell you something about shoulder impingement syndrome. This is a very common condition in which your rotator cuff tendon muscles or the bursa, which is a fluid-filled pocket to prevent friction while your muscles are moving, these structures sometimes can get compressed in between the tip of your shoulder and your arm bone, which is your humerus, and your scapula, which is humerus and acromion process. So as you can see on the picture, it could be somewhere here where you can find the impingement. These tendons or bursa can be impinged while doing any shoulder movements, and it can cause pain. The impingement causes pain, weakness, and limits your mobility in the shoulder. This is often caused by repetitive overhead movements such as throwing, swimming, or lifting for work, but can also be caused by structural abnormalities in the shoulder joint or due to poor posture. The symptoms that you feel with shoulder impingement syndrome typically include pain in front of the shoulder, especially when reaching overhead or behind your back, as well as weakness in the shoulder, and difficulty performing activities that require lifting, reaching, or any repetitive movement. In some cases, you may also experience swelling or tenderness in the shoulder area. So how do we fix this? Treatment for shoulder impingement syndrome often involves combination of rest, inflammatory medication, physiotherapy, and some exercises. The key is to strengthen the shoulder muscles and improve flexibility and mobility. Here at UCC Physio, we do a complete comprehensive functional assessment of your shoulder, assessing your range of motion, strength testing, stability, and posture. Based on this information, we develop an individualized treatment plan to improve shoulder function and address any underlying factors that may be contributing to your impingement. This includes a combination of manual therapy techniques, therapeutic exercises, activity modification, education on self-management strategies. It's important for individuals with shoulder impingement syndrome to avoid activities that aggravates their symptoms and to follow their healthcare providers' recommendations for rehabilitation and prevention. Usually with shoulder impingement syndrome, you are likely to feel pain around your shoulder joint. There will be some tender points or point tenderness right on top of your shoulder here where the muscle attaches or where your acromion process is. Or you will feel some pain or discomfort in front of the shoulder. Your shoulder mobility can be restricted, so when you try lifting your arm up, you feel pain and weakness and you're not able to move the shoulder above your head. At UCC, while assessing the shoulder impingement syndrome, usually we ask patients to keep their arm stretched out, and then the therapist applies pressure on their arm. And if patients are not able to hold it or complain of pain, that means you have a similar condition to shoulder impingement. If you're still able to hold the arm stretched out, but you still have pain in the shoulder, you could try some exercises that we have to offer. The first exercise you could do for shoulder impingement syndrome is take a towel, roll it, put it under your elbow. Make sure the angle is 90 degrees, and what you have to do is just press it towards you and hold it for 5 seconds. And let go. And you could repeat this activity 7 to 10 times, and you could do a couple sets a day. The other exercise you could try is take a resistance band, just tuck it under your foot, wrap it around your wrist, keep your elbow straight, and make sure there's some tension in the band. And then you want to lift it as high as possible and put it down. Every time you can try to go higher and higher, and this is the best way to strengthen your shoulder muscles.
So if you're ready to finally get back to living your life without pain, book an appointment with us by clicking the book online button. Or you can schedule a free phone consultation with myself by clicking the free consultation button on the bottom of your screen so I can answer any of your questions that you may have. Welcome to UCC Physio. Your recovery begins here.